Good afternoon. This is Jason Jones with the Solidarity segment. Joining me this evening is Paul Kachaha with the Northwest Indiana Medicare for All. He is the chairman of that organization. Good evening, Paul. Welcome.
Good evening. Thank you for inviting me to talk about Medicare for All.
So you've been engaged in struggle for working class issues for a long time, and we have been fighting here in Indiana for a Medicare for All program for quite a while, going back at least 20 years since I've been here. Go ahead and just sort of describe the coalition and organization there in Northwest Indiana and Gary, and what are some of the sort of focus right now, either statewide or nationally, in this fight.
Well, in the Medicare for All movement around the country is got many different facets to it. There's a lot of groups, even within Indiana, but none of them have a central organization that they're connected to. We're all loosely connected. For those of us who know who we are, there are different names for them. There's a group there in Indianapolis where you're at, and there's a group down in Bloomington. Down in Bloomington, it's run by Dr. Stone, who I've known for a long time. I was former president of United Steelworkers 6787 back in the early 70s and 1970s, and he was part of an organization that we had for the group bill back then that was HR 676 that was introduced by John Conyers, and that bill was an expanded and improved Medicare for all, and that bill morphed into the bill we have now, which is 1976. Conyers is no longer in Congress. This bill was put together by Jaya Paul, Congresswoman Jaya Paul, and out of Washington and state, and that's the legislation that the country is pretty much united around. There is a push to make a state-by-state approach. In fact, the Progressive Democrats, who I've been in a lot of their town hall meetings on Sundays, and they are pushing the state-by-state approach. And right now, California is the closest to the state-by-state. That's a controversial approach, something that we could never see here in Indiana for a long time. But that's some of the thinking that Canada sort of had that approach, and that we should take that approach. Though there is a lot of controversy over whether that was exactly how Canada did it. But anyways, our group here in Northwest Indiana, we're focused right now on trying to get our newly elected, he's been in office for 1 year now. He replaced the prior congressman, our United States Congressman, Frank Mervan. He has not endorsed Medicare for All, HR 1976. His predecessor, Pete Visclosky, who had been in for 32 years, he had endorsed the prior bill, which was 1834. He had endorsed the Medicare for All that was put in by Jaya Paul when it was 1834. For some reason, the number changed this session of Congress, and that doesn't usually happen. For example, HR 676 stayed the same all throughout every congressional term. Each Congress it was introduced, and it was still the same number. But so, anyways, and back then we had for HR 676, we had a all unions committee, and that's what I was part of, all unions committee for that legislation, and it was that committee was headed up by Kay Tillow down in Kentucky. She's down in Kentucky, a nurse down there. So Kay is still very active in the Medicare for All movement, and you'll see her involved in some excellent videos that are out there from the Physicians for a National Healthcare Plan, National yeah, I think PNHP is the name of that group. And they're very big. You can look up that if you're looking for them, and the nurses union, which this picture behind me is the nurses union, from the nurses union Medicare for All page. They're a huge pusher of the Medicare for All, HR 1976. Remember that number, 1976. Kind of has a patriotic ring to it. But so here in Indiana, here in Northwest Indiana, we're pushing Frank Mervan to endorse 1976. And we had a meeting with him back in April, and he has yet to give us the answer as to whether he's going to endorse it or not going to endorse it, but he hasn't endorsed it. And we have another meeting scheduled with him soon. It's in the process of being scheduled. We have postcards printed, and we're prepared to go to any public events that he holds, like a town hall meeting or anything. I don't know what he's planning on doing. His predecessor had town hall meetings, and that's one of the things our group did was raise a lot of hell and pressure him in those meetings to get him to endorse it. And that's what we plan on doing with Congressman Mervan. And the postcards, we have postcards printed, and they just got printed. We just got them like last week. So our last meeting was not held in person. We've been holding for the last 3 or 4 months. We've been holding a hybrid meeting of in person and on Zoom. And this past week we went, because of the pandemic's rise here in Indiana, we went to just Zoom. But hopefully in the next month or so, we can start getting those postcards out to pressure him to endorse HR 1976. Now, I do know that we also, there was an organization here that I can't remember their initials right now off the top of my head, but they were a shill group for the drug industry. And they put out a flyer. They mailed the flyers out to people's homes twice. First thing they did was give Frank Mervan an Innovators Award, and for being innovative and trying to help keep down healthcare or something like healthcare costs. So then what the next flyer they put out, they attacked as radical extremists the people who were endorsing and who introduced the HR3, which is the bill to control drug prices, Medicare being able to control the drug prices, the government to be able to control drug prices. So when they put that out, we sent a letter to Mervan saying, a very excellent letter that was detailed with facts about how the vast majority of Americans want that kind of legislation. And it's actually if we get Medicare for All, it's part of Medicare for All, but also it's part of Build Back Better, the Build Back Better legislation that's in there. And Mervan has not come out in favor of in fact, he's come out in favor of Medicare and the government to be able to negotiate the prices of drugs. And so he must not be listening to that drug company.
That's good news and good to hear. So you got the postcards getting sent out soon to residents.
No, we're gonna hand do those. We're gonna hand collect, not mailing them out to anybody. There's another thing we are also we have a resolution that we drafted for unions. The steelworkers got Mervan elected, and we've been hitting steelworker unions to endorse HR 1976 and have had no blowback from that at all. But we're also expanding to other unions to get, and this is something tactic that was learned in the All Unions Committee for HR 1970 for HR 676, was that there was a network of hundreds and hundreds, I think it was 364 local unions, labor bodies, AFL labor bodies, locals, and the international unions even that endorsed 676. So we're trying to do the same thing locally with 1976 to pressure Mervan to sign on to 1976. And so therefore we've had local 6787 and local 1010, two of the biggest locals in the steelworkers endorse it. In fact, Tom Conway, the president of the International Steelworkers Union, is on the advisory board for Healthcare Now, which is one of the major organizations pushing Medicare for all. And he's on their masthead and he's in favor. Any decent union person who's been involved with negotiations know that the biggest 80% of strikes are over healthcare. And if you have national healthcare, you have eliminated a big axe over your head in the negotiations. So
Really
we
good.
have this resolution going around, and the resolution has also been modified for town councils, city governments, town governments, city governments, and like I said, other unions besides steelworkers union. But we've had steelworker retiree organizations, which is called SOAR. They've been passing the resolution also. It's called Steelworkers Organization Back to Retirees. They've passed that resolution also. So the more of those we get passed, the more that keeps piling up. And whether by the resolution, they're supposed to notify Mervan, but regardless, we'll make sure he knows.
That's awesome. And I'm glad you mentioned the resolutions, because Indianapolis passed a resolution also endorsing Medicare for all. I think it was last summer or spring. And I want to ask real quick if people are interested who see this video and want to get engaged in this fight, how do they go about getting into this organization and this struggle?
Well, we have a Facebook page. We have two Facebook pages. We have a public Facebook page and we have a members Facebook page. And it's Northwest Indiana Medicare for All members page. Look it up on Facebook, and there you have to answer 2 questions in order to join that members page. And then on that members page, we post the notice of the meeting, and we post the agenda for the meeting. So we meet every second Wednesday of the month at 6:30 Central Time, which 7:30. We do have members who are in the Eastern time zone too. So, but 6:30 Central Daylight Time.
And I think the Physicians for a National Healthcare Plan in Bloomington does something very similar and you can go to their website or their Facebook page as well, and you can find.
If we get your email and phone number, if someone joins and we get that information, there's 2 things. They can join you can join and be just a member. We have 600 and some people that are on the members page, but we don't have that many who are quote members that have given us their email and phone number. We have about 100 phone numbers and maybe another half that many or more email addresses. I email out the notice of the meeting, and I call everybody about the meeting before the meeting, a couple days before the meeting. So, and you can become a paying member to make you a voting member, and that's $5 a month for seniors and students, and $10 for generally it's $10 if if you're a hardship and you appeal to the board, we can let you join as a member, voting member as a hardship case for nothing. So,
Paul, you mentioned you touched on the COVID pandemic. I was wondering if you could talk a little bit about how Big Pharma affects this struggle.
Well, the pandemic would have been handled totally different if we had Medicare for all. If we had Medicare for all, it would have been a much more humane approach to the whole beginning of the pandemic and the solutions to the pandemic. And so the and Big Pharma, they are dead set against Medicare for all, because part of Medicare for all legislation is for the just like in Canada, the government negotiates the drug prices, and the prices in Canada are way lower than they are here for drugs. And so they're totally against, like I mentioned earlier, with that shield group that they created to pressure Mervan into opposing wonderful legislation like HR3, which would be for the government to negotiate the prices. In HR3, they talk about how the government has to look at the countries bordering the United States and what drug prices are for those countries, and that includes Mexico, which also has real cheap drugs. If you live south of near the southern border, you go to Mexico to get drugs. If you live near the northern border, you go to Canada to get drugs. Us in the middle are too far away from those two to run to go get drugs. So there are people who actually make the trip up to Canada from the Midwest area to purchase drugs. My dad used to, when he would snowbird in Tucson, which is only a hop, skip, and a jump to Mexico, he would go down there and buy drugs for a lot of people down there.
Thank you. Thank you, Paul. I appreciate that. We'll put all the links in the description on the YouTube channel, and we'll have that up hopefully very soon. And thank you for your time, and we will let you get back to the struggle and your life. Thank you.
Okay.
Thanks, Paul.